Okay, we're starting on chapter 25, which is entitled Patient Education. So your textbook mentions the Speak Up campaign that was actually launched by the Joint Commission in 2002. If you want to look at that video, please go to the jointcommission.org website and look up the Speak Up videos. Patients who ask questions and are aware of their rights have a greater chance of getting the care they need when they need it. Patient education is one of the most important roles for a nurse in any healthcare setting. What do nurses need to educate patients about? Well, information about their disease, treatments or diagnostic tests, information needed to make informed decisions, home care or discharge information, and teach them about their medications. Information about their disease will be pertinent because they will definitely have questions. Well, any of these topics is pertinent because they will have questions. Health promotion to obtain optimal levels of health. We could also teach them that. Also, don't forget to educate their family members needed for going home with the patient, as if they were in the hospital and then going home. Home healthcare nurses, community nurses, hospice nurses, nurses in rehab facilities, they all do teaching. So, nurses need to become teachers and understand evidence-based methods used to educate their patients and their families. Teaching consists of a conscious, deliberate set of actions that help individuals gain new knowledge, change attitudes, adopt new behaviors, or even perform new skills. Learning is a process of both understanding and applying newly acquired concepts. Nurses have an ethical responsibility to teach patients. Patients have the right to make informed decisions regarding their care. The information required to make informed decisions must be accurate, complete, and relevant to the patient's needs, language, and literacy. Teaching and learning generally begin when a person identifies a need for knowing or acquiring an ability to do something. Teaching is most effective when it responds to the learner's needs. Learning occurs in 3 domains. Those are cognitive, affective, and psychomotor. Cognitive learning requires thinking and is what your exams and NCLEX tests teach you. Affective learning deals with feelings and the development of values, attitudes, and beliefs. An example would be a patient's beliefs about health and illness. Psychomotor learning involves acquiring motor skills that require coordination and the integration of mental and physical movements. Practice is needed to learn psychomotor skills. You may understand how to put in a Foley catheter, but it takes practice to perform that skill. Patient teaching may involve all 3 domains. For example, a newly diagnosed diabetic. So what does that look like in these 3 areas? Well, for that diabetic in the cognitive domain would be understanding of the disease and learning about medications. And if we're talking about the affective domain for this patient, belief and values that help can be maintained by following diet and exercise plans would be something that we would teach about in the affective domain. Psychomotor domain would involve learning how to, for instance, check their blood sugar levels. Nursing exams, by the way, are mostly at the application level and above. So take a look at this slide and think about how your learning happens in nursing. The teaching process is similar to the nursing process. So let's look at what you need to assess. Teaching is a patient-centered action. What does this mean? When providing a patient education, it's important to partner with that patient. Learning needs identified by both you and the patient determine the choice of teaching content. An effective assessment provides the basis for individualized patient teaching. Learning style preferences. Think about this. Does the patient learn best through reading material or watching and listening to a video, or do they prefer hands-on activities? Determine a patient's level of comfort before beginning a teaching plan and ensure that the patient is able to focus on the information. As anxiety increases, a patient's ability to pay attention often decreases. So assess for and moderate that patient's anxiety. If a person does not want to learn, it's unlikely that learning will occur. You assess a patient's motivation to learn and what the patient needs to know to promote compliance with his or her prescribed therapy. No therapy has an effect unless a person believes that health is important and that the therapy will improve health. Teaching adults differs from teaching children. Adult learners are self-directed. The information needs to be relevant to real-life problems. Assessing what an adult patient currently knows, teaching what the patient wants to know, and setting mutual goals improve the outcomes of patient education. Just because a patient has the motivation to learn doesn't mean they have the ability to learn. Without proper physiological, motor, language, and social development, many types of learning cannot take place. Physical strength, dexterity, coordination are all important. So think about our patients that have arthritis or paralysis. They may not be able to perform certain skills or may need specialized equipment. When we're talking about cognitive functioning, think about our patients with dementia. With those patients, we definitely have to involve the family in the learning. And then let's talk about developmental levels. All ages, level of adult with developmental problems, we have to consider all of this. Their reading level. Ask a patient to read a handout and teach back. Both the AMA and NIH recommend patient education materials be written on the 6th grade level or lower. Think about our patients too with sensory deficits and how will we teach them. Physical condition. If a patient is in pain, they have a high anxiety level. Or if our patient is fatigued, then teaching may need to be done after anxiety, pain, and their fatigue. Once those are addressed, then it's a better time to teach. Assess the following environmental factors also. Distractions or persistent noise, what's the comfort of the room, and then available equipment are all things we need to consider. After the assessment is completed, select a nursing diagnosis that best reflects the patient's learning needs. Remember, the nursing diagnoses that start with readiness for involve health promotion. The patient is requesting information to improve their health. The more specific the plan, the easier it is for nurses to follow. Include the patient when determining priorities for patient education. Plan teaching activities for a time when the patient is most attentive, receptive, and alert. Begin instruction with essential content because patients are more likely to remember information that you teach early in the teaching session. Especially with our older adults, you need to keep teaching sessions short, and you may need collaboration. So you may need to get information from other disciplines like nutritional information or even from case management. A teacher is more effective when presenting information that builds on a learner's existing knowledge. A patient quickly loses interest if a nurse begins with familiar information. It's important to look at what has previously been taught in the EMR. Teaching can be formal through lecture in groups or informal one-on-one with small pieces of education done with each interaction. Many nurses find that they are able to teach more effectively while delivering nursing care. Teaching during routine care is efficient and cost-effective. Patient education is not complete until you evaluate outcomes of the teaching learning process. Engage patients in the evaluation process to determine if they have learned essential material. It's also important to determine if patients believe that they have information necessary for when they're discharged to home. Teach back is closed-looped communication technique that assesses patients' retention of the information imparted during a teaching session. If the patient has difficulty recalling the material or demonstrating a skill, modify and repeat the content and reassess his or her retention. The nurse is legally responsible for providing accurate, timely patient information that promotes continuity of care. Therefore, it is essential to document the outcomes of teaching. A patient newly diagnosed with diabetes needs to learn how to use a glucometer. Use of a glucometer constitutes, yes, we just talked about this, psychomotor learning.